Good day. My name is Todd Ahrens, President and CEO of Hannibal Regional Healthcare System, and today I would like to update you on our ongoing efforts in the fight against COVID-19. First, I want to again assure you that we continue to work diligently to adapt and ensure that we are here to serve our community. It is very important to us to keep our community updated and educated about the changes in this very dynamic situation. I know there are many questions about testing and results. We are now providing daily updates on our website with information on all COVID-19 testing at Hannibal Regional Hospital, including positives, negatives, and pending tests. Please visit this site for updated numbers at hannibalregional.org. Additionally, we have implemented a new drive-through testing service which allows individuals to call from their home, answer screening questions based on the current CDC guidelines, and if they meet the criteria, drive to our campus and be tested at our drive-through testing center. Information about this service and our newly implemented telehealth services can be accessed on our website or by calling our COVID-19 hotline at 800-845-7405. With these enhanced services implemented, the ability to test individuals for the virus in a good position, and our supply of PPE stabilized, I've asked our leaders, including the medical staff, to now focus their attention on being prepared for a surge of patients that would need to be hospitalized. Obviously, my hope is that this planning ends up being an exercise for a reality that does not come to fruition. However, people much smarter than me are conducting research based on the science and medicine involved that indicates this planning is prudent. As a member of the Missouri Hospital Association Board of Trustees, I'm also working with governmental and healthcare leaders to discuss how Missouri, as a state, would address a surge of the virus. As you have likely heard in the news media, this statewide response could entail the creation of alternate care sites in large public stadiums and venues where the less acutely sick patients could be treated so that existing hospitals can take care of the sicker patients. As I have said before, we need your help in this fight. Please, for the sake of your family, our community, and all healthcare workers, abide by all the CDC guidelines to mitigate the spread of this virus. This is the best way to flatten the curve, preserve our healthcare resources for any surge, and save lives. Scientists and researchers are predicting that our state will most likely be impacted in the coming weeks, and that we could continue to be impacted for several weeks or even months. Many experts are advising us that we should liken this to a marathon, not a sprint, and I agree. It is so important for you and your family to take this seriously, remain calm, and do your part to stop the spread of this virus. This includes practicing social distancing, washing your hands, and following all CDC guidelines. Above all, if you can, stay home. Please do so. Our healthcare workers are coming to work every day to serve you, and in return, we ask you to please stay home if you can. In closing, I want to specifically thank our team of 1,200 men and women that are coming to work every day, taking care of all our patients, both our normal patients and those stricken by this virus. Then, after working those 8, 10, 12, and sometimes even 16 hours, they go home to the stresses and anxieties of family life impacted by social distancing and complicated by the fact that they are at the bedside treating patients that may have one of the most contagious diseases our country and world has seen in the last 100 years. Speaking now as a consumer of healthcare and not just an administrator, these men and women are nothing short of true heroes. And of course, there are numerous other frontline workers throughout our community who work selflessly every day to meet the essential needs of our community. So there are many heroes in this fight against coronavirus, not just those that work in healthcare. Please remember, we are all in this together. We all need to do our part. Together, we can get through this. Together, we can get back to better. Together, we are Hannibal strong. Thank you.